Going through any form of lower back pain is hard. I've been there, I know exactly what it feels like. Whether it's the first time it's happened to you or something that you've been going through repetitively for years. It's important for me to make sure that all of our patients are equipped with the right information to make sure that they're leveraging the adjustments to getting the most out of their care. Every day I get questions. Greg, do I sit? Do I move around? Do I use ice? Do I use heat? How do I sleep? How do I sit? These are really important questions, and what I want to do is I want to give you a clear guideline of knowing exactly what to do and also what not to do to make sure you get the best results. Let's first start around with a common one known as, am I best to sit down or am I best to walk around? Often what I find is the best thing to help the recovery process is to get movement through the body, movement through the spine. And so any form of walking is going to, as hard as it can be to start with, is it going to be much better for you than sitting down for long periods of time. If the pain's so bad that you can't walk, making sure that you're taking breaks. You're not sitting down longer for about 30 to 40 minutes. You're getting up and you're moving around. Often what I'll do is I'll tell people, go to the pool, get some movement through the pool. The water will take the gravity off. It'll make sure you get the range of motion through all the joints and you're getting that movement through there. Very effective for that. If you're finding that it's still too difficult, then I'd advise lying down. Lying down is actually much better than sitting down for long periods of time. The second one is going to be, do I use ice? Do I use heat? It's a common debate that I hear. If you're suffering from acute nerve pain, initially I'd advise using ice. Just ice it 15 minutes on, 15 minutes off, and you can alternate this. You can do it as much as you want, just making sure you're giving it a break. What that will do is it will limit the inflammation. By limiting the inflammation, it reduces the pain receptors. What this will do is allow you to manage that pain much better. I always say use ice as opposed to strong pain medication. Only reason being is if you're taking a lot of the medication, you won't feel the pain, and then often you can bend down or you can twist and you can turn, you can actually cause more damage. Using ice is a great way of managing that, and it allows your body to still speak to you via pain, but allows you to get the inflammation down and accelerate that healing process. The third one is going to be the sitting posture. How do I sit down if I have to sit? Often, someone will be getting better and they'll sit down for long periods of time and they'll feel like they've gone backwards. They've gone back to where they've been. If you do have to sit down, one of the most important things is you leverage your chair. You want to sit all the way back at the buttock muscles and allow those sit bones to take all the weight. The reason why sitting down is so hard on the lower back is because it puts pressure on the disc and it takes all of the weight. One of the most important things that you don't do is often I'll see it is you see people's backsides will come forward and they'll kind of slouch down in the chair. By doing that, what I'm doing is I'm actually putting all of my upper body weight right on the L4, L5 disc. If you're suffering a disc condition, this is going to be excruciating after long periods of time. If you have to sit down, bring the backside all the way back up and keep the weight down through those sit bones. Try not to cross your legs at all. That'll turn the pelvis. It'll cause it to be unstable and it'll just rock things around too much. The fourth thing is going to be sleeping posture. It's a common question that I get. I struggle with this myself. Often I'll go to sleep on my back and I'll wake up on my stomach and I'll try and go back to sleep on my back again and find it really hard. The best two sleeping postures are either on your back or on your side. If you're going through a lower back condition, often I find the side sleeping is the best one for it. What I encourage people to do is to put a pillow in between your knees. What that does is it keeps the pelvis square. It makes sure there's no rotation in that lower back area that can happen overnight, and it will prevent you from rolling over onto your stomach, causing all of that area to twist during the night. It keeps it square and makes sure that it just allows the stability in that lower back to make sure you get the best results. One of the big factors too is time. Often, we live in a society now where we want results straight away. We want to feel better immediately. We become very instant gratifying, and I get that. But one of the most important things to realize is that, the body it takes time to heal. Just as it takes time to degenerate over time and slowly deteriorate, it's important to understand that this problem may have developed months ago, may have developed years ago, and all of a sudden it's that last straw that breaks the camel's back and bang, you go down. Be patient with your body. It will heal. Give it time. Give it rest. Allow the body to do what it does best, and that's heal. By doing these things, it's going to make sure that, when you go out from your adjustments or during the weekend, you're not undoing all of that great work that you've done. Also understand that results it'll be a slow progression at times, especially if it's a long, it's a long problem that's been there for quite a long period of time. Just allowing that body to heal and knowing exactly what to do so you don't undo all of the great work that you've done. I hope this helps. Any other questions, just let me know, but I want to make sure you know exactly what to do to manage this.